Good day everyone, I am 𝐬𝐨𝑥𝐿𝐢𝐚 from BSN111B, and today I'll be showing you my return demonstration in obtaining vital signs. Vital signs are the measurement of the body's most basic functions such as body temperature, pulse rate, respiratory rate, and blood pressure. It is important as it is useful in detecting and monitoring medical problems. But before we start, we need to ensure the completeness of all the necessary equipment needed. So we have here digital thermometer used to measure body temperature, stethoscope and sphygmomanometer used to measure blood pressure, wristwatch with second hand used to measure pulse rate and respiratory rate, gloves to protect our hands from cross-contamination, alcohol pads and a tissue for the disinfection of all of our equipment, and lastly, we have alcohol for hand hygiene and disinfection. So the organization and completeness of all the necessary equipment needed ensure our efficiency as student nurses. Now that we are all set, we can now proceed to the assessment. So the first assessment that we're going to measure is the body temperature of our patient. So body temperature is important as it reflects the balance between the heat production and the heat loss of our body. There are a lot of sites that we can obtain the measurement of it. It can be temporal, oral, rectal, axillary, or in the tympanic membrane of our patient. But for today, I'm going to measure the body temperature of my patient using oral and axillary site. So prior to the assessment, we need to ensure the privacy of our patient by closing any doors or any windows, and also we need to ensure the comfort of our patient by adjusting room temperature. And of course, we need to introduce ourselves and verify the client using 2 identifiers. And of course, we need to perform hand hygiene. Now we are going to start assessing the patient. Good day, sir. May I come in?
Yes, you may come in.
Good day, sir. I am 𝐬𝐨𝐿𝐢𝐚, your student nurse for today. Can I see your wristband, please? Can you state your name?
I am Patrick Anay.
How about your birthday?
It's on April 26, 2002.
And how would you like me to call you?
Just call me Mr. Patrick.
Okay, Mr. Patrick, today I'm going to be assessing your body temperature, and I'm going to touch some parts of your body, and of course, there's a lot of movement that you should follow. Would that be alright?
Yes, of course.
Do you have any questions or clarifications before we start?
None so far.
Okay, that's great. Now I'm going to start assessing your body temperature. Now I'm going to perform first the oral method of obtaining body temperature. But first, I'm going to position my client appropriately. Okay? So my client now is in sitting position, and I'm going to disinfect my thermometer using alcohol pad in a firm twisting motion prior to the placement. After disinfecting, I will now place the tip of the thermometer on either side of the frenulum. Can you open your mouth, please, Mr. Patrick? Can you raise your tongue? Okay, I'm going to insert the thermometer. Can you close your mouth? Okay, can you hold the thermometer, please? Okay, now I'm going to turn on the thermometer. And now we will wait for the appropriate amount of time after the placement. So the electronic thermometer will indicate the complete reading through a light or a tone. Now we will wait. Now that we can hear the tone of the thermometer, it means that it is done reading the patient's temperature. Can you open your mouth, Mr. Patrick? Okay. So your temperature is 36.5, which is a normal temperature. Now that I have removed the thermometer, I will now disinfect it by wiping the tip of the thermometer using alcohol pad in a firm twisting motion from the cleaner area towards the more contaminated area. Now I'm going to place back the thermometer. Now I'm going to remove my gloves and perform hand hygiene to prevent the spread of microorganisms, and I will wash the thermometer for further disinfection. Now that I'm done disinfecting, I will now document the temperature of my patient to his TPR sheet. Now I'm going to perform the auxiliary method of obtaining body temperature. So the first thing we need to do is to move the sleeve of our patient away from his torso and instruct the patient to raise his arm to inspect for any lesions or any perspiration. Mr. Patrick, is it okay if I'll move your sleeve for me to assess your body temperature through your armpit?
Yes, it's okay.
Okay, thank you. Okay, can you raise your arms, please? Okay, so per inspecting, there are no lesions or perspiration on the armpit of my patient. Now I'm going to pat dry the axilla of my patient using a tissue. Okay, now I'm going to insert the tip of the thermometer to the center of the axilla. Okay, can you lay down your arms, please? Okay, now we're going to turn on the thermometer and we will wait for the appropriate amount of time after the placement. Again, the electronic thermometer will indicate the complete reading through a light or a tone. Okay, now that we can hear the tone of the thermometer, it means that it is done reading the patient's temperature. Okay. Okay, your temperature is 36.2, which is a normal temperature. Okay, it is important to know also that the axillary temperature is 1 degree lower than the oral temperature. Okay, since I already removed the thermometer, I will now disinfect it by wiping the tip of the thermometer using alcohol pad in a firm twisting motion from the cleaner area towards the more contaminated area. Now I will place the thermometer back here. Now I will remove my gloves and perform hand hygiene to prevent the spread of microorganisms, and also I will wash the thermometer for further disinfection. Now that I'm done disinfecting, I will now document the temperature of my patient to his TPR sheet. Now, I'm going to assess and measure the pulse rate of my patient. So a pulse is a wave of blood created by the contraction of the left ventricles of the heart, and for me to measure it, I need to do palpations on both sides of my patient. It could be on his temporal, carotid, apical, brachial, radial, femoral, popliteal, tibial, or in his versalis pedis. But for today, I'm going to assess and measure the radial pulse of my patient since it is the most accessible pulse site. So prior to the assessment, we need to ensure the privacy of our patient by closing any doors or any windows, provide adequate lighting, and ensure the comfort of our patient by adjusting room temperature. And of course, we need to introduce ourselves verify the client using two identifiers, and of course, we need to perform hand hygiene. Now, I'm going to assess my patient. Good day, sir. May I come in?
Yes, you may come in.
Good day, sir. I am 𝐬𝐨𝐜𝐿𝐴𝐼𝐚, your student nurse for today. Can I see your wristband, please? Can you state your name,
I am Patrick Anay.
your birthday?
It's on April 26, 2002.
Okay, and how would you like me to call you?
Just call me Mr. Patrick.
Okay, Mr. Patrick, today I'm going to be assessing your pulse rate, and I'm going to touch some parts of your body for me to assess your pulse. Would that be alright?
Yes, of course.
Okay, do you have any questions or clarifications before we start?
No, none so far.
Okay, now I'm going to start assessing your pulse. So in assessing the radial pulse, I'm going to use 3 fingers of my hand, and always remember to avoid using your thumb because your thumb has its own pulse and it might give us confusion in measuring our pulse rate. Okay, may I see your hand, please? Okay, now I'm going to trace his thumb because this is where the pulse is located, and I'm going to place my fingers right here to feel the pulse. Okay. Aside from the beats per minute to count, I also need to check for the strength of his pulse using the 0 to 3 plus scale, where 0 being absent, 1 plus as weak pulse, 2 plus as normal pulse, and 3 plus if it is bounding. I also need to check for its rhythm if it is regular or irregular. Okay? Okay. Now that I have felt the strongest pulse in his radial artery, I'm now going to start counting the beats per minute. Always remember in assessing the pulse rate, it should be in a whole minute. Avoid doing shortcuts, okay? Okay, Mr. Patrick, your pulse rate is 85 beats per minute, and it is graded as 2 plus, which is normal, and it has a regular rhythm, okay? Now I'm going to document the pulse rate of my patient to his TPR sheet. Now I'm going to perform hand hygiene for disinfection. Okay, thank you, Mr. Patrick, for your cooperation, and have a nice day.
Thank you so much.
And now I'm going to assess and measure the respiratory rate of my patient. So the respiratory rate is simply the number of breaths the person takes in a minute. It is usually done when a person is at rest and by simply counting the rising and falling of the chest of the patient. So prior to the conduct of the assessment, we need to ensure the privacy of our patient by closing any doors or any windows, provide adequate lighting, and ensure the comfort of our patient by adjusting room temperature. And of course, we need to introduce ourselves, verify the client using 2 identifiers, and we need to perform hand hygiene. Now I'm going to assess my patient. Good day, sir. May I come in?
Yes, you may come in.
Good day, sir. I'm 𝐬𝐨𝐜𝐿𝐴𝐼𝐚, your student nurse for today. Can I see your wristband, please? Can you state your name,
I am Patrick Anay.
your birthday?
It's on April 26, 2002.
Okay, now would you like me to call you?
Just call me Mr. Patrick.
Okay, Mr. Patrick, today I'm going to be assessing your vital signs, and I just need you to feel at ease and just relax. Would that be alright?
Yes, it's alright.
Okay, that's great. So in assessing the respiratory rate, I'm not just counting the number of breaths the patient takes, but also for the depth of his breathing, if it is labored or unlabored. Also for its rhythm, if it is regular or irregular, and for its character. Okay. It is important to take note that one rise and one fall of the chest is equivalent to one respiratory rate. Okay, Mr. Patrick, is it okay if I touch your hands?
Yes, it's okay.
Okay, so can you put your hands here? Okay, just relax, okay? Okay. Okay, so your respiratory rate, Mr. Patrick, is 18 breaths per minute, and also it has a regular rhythm and it is unlabored, okay? Now I'm going to document the respiratory rate of my patient to his TPR sheet. Now I'm going to perform hand hygiene for disinfection. Okay, Mr. Patrick, thank you for your cooperation and have a nice day.
Thank you so much.
Now I'm going to measure the fourth vital sign of my patient, which is blood pressure. So the blood pressure is the pressure of the circulating blood against the walls of the arteries, and it can be obtained using stethoscope and sphygmomanometer. So prior to the conduct of the assessment, we need to check all of our equipment if it is intact or if it is functioning properly. Okay, so for checking, there are no problems on my equipment, like there are no leaks between the tubing and the sphygmomanometer. And also, I have the right size or the correct size of my cup. So before we start the assessment, we need to ensure the privacy of our patient by closing any doors or any windows, provide adequate lighting, and of course, we need to provide comfort for our patient by adjusting room temperature. And of course, we need to introduce ourselves, verify the client using 2 identifiers, and of course, we need to perform hand hygiene. Now I'm going to start assessing my client. Good day, sir. May I come in?
Yes, you may come in.
Good day, sir. I am 𝐬𝐨𝐿𝐴𝐚, your student nurse for today. Can I see your response, please? Can you state your name,
I am Patrick Anay.
your birthday?
It's on April 26, 2002.
Okay, and how would you like me to call you?
Just call me Mr. Patrick.
Okay, Mr. Patrick, today I'm going to be assessing your blood pressure, and I just need you to feel at ease and just relax. Would that be alright?
Yes, of course.
Okay, now may I just ask if did you smoke or do you take anything with caffeine in the last 30 minutes?
No, not at all.
Okay, so I asked the patient if he smoked or took anything with caffeine because smoking constricts the blood vessel and caffeine increases the pulse rate. So this too may cause a temporary increase in blood pressure. Okay, can you move here please, Mr. Patrick? Okay. Since the patient is in sitting position, we must make sure that his feet is on the ground because blood pressure will increase if the legs are crossed. Okay, can you put your arms here in the table, please? Okay. Also, his arms must be at heart level because if the arm is in lower level, it will give us a high blood pressure reading, and if the heart or if the arms is in the high level, it will give us a low blood pressure reading. Okay. Also, since this is the initial examination of my patient, I will perform the preliminary palpatory determination of his systolic pressure. So the initial estimate will give us the maximal pressure that the sphygmomanometer will be elevated in a subsequent determination. This will help us to avoid underestimation of the systolic pressure and overestimation of the diastolic pressure. Now, I'm going to place the cuff around the arms of my patient, just about 2.5 centimeters above his antecubital space. Okay, now I'm going to palpate his brachial pulse using my 3 fingers. Okay, once that I have found the brachial pulse, I'm going to inflate the cuff until I no longer feel the pulse. Okay, now I will deflate the cuff, and I have taken his initial systolic pressure, which is at 110 millimeters of mercury. Now you'll wait for about 2 to 3 minutes before taking further measurement, because a waiting time will give the blood that is trapped in the vein enough time to be released. So the actual taking of the blood pressure, I'm going to inflate the cuff at about 30 millimeters of mercury, higher than the estimated systolic pressure. So this will help us avoid missing the auscultatory gap, which is the temporary disappearance of the carotid cuff sound during the inflation of the cuff. And also, I'm going to use my stethoscope, but first I'm going to disinfect the earpieces, the bell, and the diaphragm to avoid contaminating our patient. Now, I'm going to insert the ear attachment so that it would be tilted slightly forward. So it is important because sounds can be clearly heard when the ear attachment follow the direction of the ear canals. Also, ensure that the stethoscope must hang freely from the ear to the diaphragm, because if the stethoscope rubs towards an object, the noise can block the sound of our blood pressure in our arteries. And also, I'm going to use the bell part of my stethoscope because the bell is best used for low frequency sounds such as our blood pressure. Now I'm going to place the bell towards the pulse site or the brachial pulse site. Also remember that it is important to place the bell directly into the skin, not to the cloth over the site, because for us to avoid the sound made from rubbing the amplifier against the cloth. Now I'm going to inflate the cuff until the sphygmomanometer reads 30 millimeters of mercury above the point where the brachial pulse disappeared. So I'm going to inflate the cuff to 140 millimeters of mercury. So I'm going to slowly release the cuff so that the rate or the pressure will decrease to a rate of 2 to 3 millimeters of mercury per second, because if the rate is faster or slower, error in the measurement will occur. Now that I have fully deflated the cuff, the first sound that I have heard would be his systolic pressure, which is the carotid cuff phase 1, and the muffled with soft blowing quality would be his first diastolic pressure, which is the carotid cuff phase 4, and for the second diastolic pressure or the carotid cuff phase 5 would be the level of silence after the last sound that I have heard. Okay? Now I'm going to remove this sphygmomanometer. Now we are going to wait for about 1 to 2 minutes before making further measurement to permit the trapped blood in the vein to be released. Also, we can repeat the above steps to confirm the accuracy of the reading, especially if it falls outside the normal range. If there is greater than 5 millimeters of mercury difference from the two reading, additional measurement may be taken. And also, since this is the initial examination of my patient, I'm going to do the procedure again on his right or in his other arm. Okay? Okay, Mr. Patrick, is it okay if I'll do the procedure in your other arm?
Yes, of course.
Okay. Okay, so your blood pressure is 115 over 75, which is a normal blood pressure. Okay. Now that I'm done assessing the blood pressure of my patient, I'm going to disinfect the sphygmomanometer and also my stethoscope to avoid cross-contamination. Now that I'm done disinfecting, I'm going to do hand washing, and also I'm going to record or document the blood pressure of my patient to his monitoring sheet. Okay, thank you, Mr. Patrick, for cooperation, and have a nice day.
Thank you so much.
Now I'm going to take the oxygen saturation of my patient using this pulse oximeter. So the goal of this procedure is that the patient should exhibit arterial blood gas saturation within acceptable limits or greater than 95%. So the first thing we need to do is to review the chart of our patient to check for any problems that might affect the patient oxygenation status. Okay, so prior to the conduct of the assessment, I'm going to ensure the privacy of my patient by closing any doors and windows, and of course, I'm going to perform hand hygiene. Now I'm going to start assessing my patient. Good day, sir. May I come in?
Yes, you may come in.
Good day, sir. I am 𝐬𝐨𝐜𝐿, your student nurse for today. Can I see your wristband, please? Can you state your name,
I am Patrick Anay.
your birthday?
It's on April 26, 2002.
Okay, and how would you like me to call you?
Just call me Mr. Patrick.
Okay, Mr. Patrick, today I'm going to be assessing your oxygen saturation with the help of this pulse oximeter. So this device is used to measure the level of oxygen in your blood. So I just need you to feel at ease and just relax. Would that be alright?
Yes, of course.
Okay. So in assessing the oxygen saturation of my patient, we need to select the appropriate site for the application of the sensor. It could be in his index finger, middle finger, or his ring finger. And I also need to check for his capillarity field and also for his pulse rate, which is close to the site. Okay, now I'm going to check for capillarity field. Can I see your hands, please? Okay. Okay. Now I'm going to check for your pulse. Okay. Now I'm going to disinfect the selected area and also for the pulse oximeter to avoid cross-contamination. Okay, now I'm going to place the pulse oximeter on the index finger of my patient. Now we'll wait for the result. Okay, Mr. Patrick, your oxygen saturation is 98, which is a normal range. Now I'm going to disinfect the pulse oximeter. Also, I will remove my gloves and perform hand hygiene to avoid cross-contamination. Okay, now I'm going to document the oxygen saturation of my patient to his monitoring sheet. Okay, Mr. Patrick, thank you for your cooperation and have a nice day ahead.
Thank you so much.
And that's it for my return demonstration. Again, I am 𝐬𝐞𝐝𝐢𝐚 from BSN 111B. Thank you for watching.